So the state of Illinois is offering up Shield COVID-19 tests to public schools across the state after having offered these to public schools for the bulk of the COVID-19 situation to do screening and asymptomatic testing of kids and teachers in particular, and staff at public schools here in Illinois. You either have to show your COVID-19 vaccine card or you have to test regularly. And some of those are at your cost. So the COVID-19 situation, as we've got schools going on, of course, school starts this morning for Springfield schools. Schools have started already in other area school districts. But the state of Illinois is offering up even more federally funded COVID-19 tests that are made by the University of Illinois. And U of I came up with this Shield COVID-19 testing protocol. It's a spit tube, and they've been promoting this, saying it's revolutionized COVID-19 testing. But, we had a lot of asymptomatic testing going on. Even at the State House, they were requiring people to take a COVID-19 Shield test in order to go into certain offices or certain committee rooms. And a lot of people complied with that. And I was able to get some of the data for one particular week, and it cost like, $20,000 or $30,000. So it's not free. Taxpayers are paying for this. And there's lots of money involved. We're talking hundreds of millions of dollars involved in these COVID-19 tests. Well, now the CDC has walked back and said that asymptomatic testing is no longer necessary. Then, of course, the CDC says that they've got a lot of cleanup work to do after the handling of COVID-19 in the past 2.5 years. But that's another story for another day. But I wanted to focus on the Shield testing and some questions that came up in the spring back in March at the State House to the University of Illinois President Timothy Killeen. And this was during a budget conversation in the Illinois House. But State Representative Deanne Mazzochi, she had a line of questions, and we'll actually unpack some of these questions that she had for the University of Illinois president, and all about this Shield COVID-19 testing. Again, spitting into a tube. Your kids had to do this. If you're a teacher, you had to do this. If you were a university student, you had to do this. But some of the questions that were asked included, was this done through voluntary consent and informed consent? Are you keeping DNA samples? How much money is involved here, and who's getting that money? So here's some of Timothy Killeen's response to Deanne Mazzochi's questions from back in March, and then we'll review a couple of correspondence that have happened since then. Again, here's Timothy Killeen.
It's very exciting because we have pioneered a new technology. It's saliva PCR genomics, essentially. And we've managed to create a system where individuals, including very young people, are prepared to give saliva samples to be looked at for their signatures of viral signatures. And we've done that at 8 million cases, and we have that data, and that data is going to be publicly available, and we can make all kinds of assessments about viral load, speed of recovery, age groups. It's going to have to be anonymized, of course, for patient records. So what you're
let me stop right there. Wait.
I can just finish my comment because you've touched on something that's very exciting for us. This is a new technology that we've come up with at the University of Illinois system that has already saved lives in the state of Illinois and is performing extremely well outside of the state of Illinois. I could list prestigious universities, Toyota factories, Rivian factories that are using it. It has these other applications.
I know the spiel on Shield. I get it. But I'm getting at a more fundamental issue. Is who owns? So you've collected all of these saliva samples, which includes DNA samples, it includes the viral load samples, and all the rest of it. Who owns all of that data? Are you saying the University of Illinois owns the data?
Yes, it's not a private, it's wholly owned, if you like, that
right.
It's
and you're going to
university related organization that reports into the Board of Trustees.
Right.
The board managers are appointed by the Board of Trustees. So it belongs to us, which means you too.
Does it belong to U of I directly, or does it belong to U of I through the Shield T3, or does it belong to U of I through Shield Illinois and if not for profit?
Well, we have two entities. Again, they're separate entities. One has a board of managers, Shield T3, appointed by the Board of Trustees, and it reports to the Board of Trustees.
Which legal entity owns the student data that you have collected?
University of Illinois System, Board of Trustees.
So again, questions about who owns this data, this DNA data, because when you spit into a tube, it's how you do the 23andMe stuff. You just spit into a tube and you send that off and you get your family history. But there were several other questions that were asked. Deanne Mazzochi asking, can the University of Illinois establish that every person who provided saliva samples as part of SHIELD's research and development efforts did so through free and voluntary consent and not as a condition of university employment or attendance? And in particular, the response to that was from the University of Illinois. They responded in a letter saying, yes, every person who provided saliva samples to the SHIELD Research and Development Program did so through free and voluntary consent and not as a condition of employment or attendance. Now, we might get into some of the minutia there, but in particular, you have people who are being required to test as a condition of their employment. We've seen here in Springfield a music teacher that lost their job because they refused to show their vaccine status and they refused to provide saliva samples. So are there still some unanswered questions here? We'll talk with somebody coming up after the break to delve into that here with Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and... Back with Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY. Springfield's News and Talk. We heard last segment a few of the Q&A from March of this year that State Representative Deanne Mazzochi had for the University of Illinois Systems President Timothy Killeen about the SHIELD COVID-19 saliva tests. And with the Department of Public Health offering up even more quote-unquote free saliva tests for schools across the state, schools starting up this week, if not last week for a lot of districts across the state. You're still paying for this. It's still taxpayer funded, even though it's coming from federal dollars. But how much money's been involved here? Who's making that money? And what about the unanswered questions concerning informed consent and possible collection of DNA data? We talk now with State Representative Deanne Mazzochi here. Representative, thanks for taking time. We've got about 6 minutes here. Let's get to the crux of this. It seems that there's twofold issues. One being the privacy and the whether or not we were provided informed consent to spit in tubes, but also the money side of this. So what are your chief concerns and what unanswered questions do you still have? Good morning.
Well, good morning, Greg. Well, I can tell you that my unanswered questions certainly are going to go past 6 minutes. They could probably go 6 days. But one of the things that in particular I was very concerned about, and I think I spoke with this about President Killeen at one of our hearings, is that there was this illusion being given that the individuals who are providing samples were doing so with free and full and informed consent with the right to refuse. And that's simply not borne out by the documents, records, and frankly, the whistleblower testimony that has been provided to me by people who were on campus at the time. So that is concern, a major red flag concern number one. The second concern that I have is that, while there has been some confusion over what's actually being done with some of the samples, I have documents from the University of Illinois under what's titled an October 15th, 2020 consent form that specifically states there is no scheduled date at which saliva samples will be destroyed or no longer used. This is because information that is collected for this study may be analyzed for many more years, and it is not possible to determine when analysis will be complete. Your de-identified information and or saliva could be used for future research without additional informed consent. So that's another area where I think both students within the University of Illinois system and then Certainly, anybody who has been subjected to this testing independently, they are actually concerned that while the university has represented that for those that are being obtained outside their quote-unquote consent form, that those samples are being destroyed after 30 days, with the exception of certain samples where they're claiming IDPH is obligating them to maintain the samples. I think that what this overall shows is that there's not any clear demarcation lines. I don't think that people really do have a clear understanding as to what their rights are, what their samples are being used for, and how their samples came to be in the possession of the university in the first instance.
I want to talk about the money side of this, because taxpayers are funding practically all of this, from the research and development to the federal tax dollars that are being used to pay for these tests for schools and others. But why is the issue of DNA in tubes so crucial? I mean, Colleen said that they're only sequencing the virus DNA, but is that possible to do, to separate the two? And why is that a concern?
Well, from my perspective as a scientist, and I've actually done research in connection with cell technology and genetics back when I was in school, once you have a DNA sample, you always have a DNA sample. The question then becomes who's allowed to access it, who's allowed to do what with it, et cetera. And again, while the university has made some representations that they will not use personal genetic material and they will not make that available for research. When you look at the scope of what was actually consented to when people were signing, the scope of the consent waiver is much broader than that. So my concern is that as long as the university has your DNA samples, at some point in time, someone somewhere can start to use them. And when you think about the number of samples that they have, the fact that they've tied it to particular demographic survey data, that's extraordinarily valuable information. And again, I don't think it was necessarily made clear to people exactly the scope of the privacy protections they were surrendering by participating in these types of testing. State
Representative Deanne Mazzochi with us with Springfield's Morning News. Finally here, the money side of this. Of course, the University of Illinois is a public university. We've got tax dollars to the tunes of hundreds of millions of dollars, from what I understand, going into this operation. Federal tax dollars paying for a lot of this. Who's making the money here?
To know who's making the money, and I think the people of the state of Illinois have the right to know exactly who's making the money and where the dollar's going. And supposedly this has all been done under the auspices of the University of Illinois. So I would think that President Colleen would be able to say exactly where the money has been going. But unfortunately, there again, we're not seeing a lot of transparency in terms of where this money is going, and also too who's ultimately going to wind up owning all of this very valuable information. Because if this just gets spun off into some additional company that goes to fund the university's coffers, I think that's something that, as a member of the Appropriations Committee, I'd like to know.
State Representative Deanne Mazzochi, what other unanswered questions do you have on this? And are we going to get to the bottom of the SHIELD testing money and the collection of the DNA? And we've got just about a minute.
Yeah, there's a whole host of pieces of information that really need to be disclosed and aligned, because one of the things that's particularly critical that I've heard from individuals within the Urbana-Champaign area is that employees of the University of Illinois were obligated to participate in clinical trials. They did not believe they had a choice. They did not believe they had a right to refuse. And frankly, when you look at some of the documentation from the University of Illinois, they're describing the collection of some of this data as mandatory for individuals to be participating in. So to me, when you start saying that something has to be mandatory as a condition of employment, or a parade of horribles will happen to you, that to me is not what usually in the research world is considered to be free, fair, and genuinely informed consent.
Well, and you've also got the governor lifting the COVID-19 vaccine mandate for schools and universities, but the University of Illinois keeping that mandate in place for staff and students. State Representative Deanne Mazzochi, greatly appreciate your time this morning.
Thanks, Greg. Always a pleasure.
It's 8 o'clock in Springfield.
From the Fly SPI Studios, take the easy way out. WMAY FM, Taylorville, Springfield's